that what you're
at
recommending?
minimum.
Okay.
The nighttime is equally as important as the morning.
And why is
At
that?
night you're sleeping. No saliva is being swished around in your mouth, and everything in your mouth is just there, stagnant in your mouth. You're going to swish at night when you brush. You're removing the bacteria and all that food that's in your mouth before you go to bed. So that's always an important time to brush your teeth before you go to bed.
And does that routine also include flossing as well?
Yes, it does. You're trying to get everything out of your mouth.
So now,
Also, I like for my patients, if they can, have some type chemotherapeutic agent, which is some type mouthwash, mouth rinse, because that's going to reduce the bacteria too. Remember, there's a lot of bacteria in your mouth.
and that's what I was going to ask you. So
what's the order?
I've heard certain things. Yeah, and I want to ask that too. I've read certain places that you should use mouthwash, you shouldn't use mouthwash, you should use a certain type of mouthwash. And what is the order of brushing your teeth in the morning or at night? Is there an order?
Like flossing, mouthwash, brush, or which? I've always gotten confused.
I prefer to floss first because you're going to get all the whatever foods is around your gum. And when you brush with the fluoride, all that's going to get around your gum line and in between your teeth. Because if you have something that's obstructing it, it's not going to get in between your teeth of fluoride to protect your teeth. That's all you're trying to have no cavities. You're trying to have no gum disease or gingivitis. So removing the food, you have better access to brushing around the gum line and the surfaces of your teeth.
And mouth. Go ahead.
Go ahead, Susan.
Mouthwash with or without alcohol, or is that a preference?
It's a preference because some patients cannot have alcohol.
Okay.
And when
so it depends. It depends. You know, there's different theories. Some people like it and some don't. Some people don't like alcohol. Some people can't have alcohol.
So, because some people say it dries out their mouth.
Well, with some people have dry mouth, you know, due to medication and different illnesses. So we recommend no alcohol because there are a lot of medicines that cause dry mouth, and alcohol will actually make it drier, make their mouth seem drier.
And Dr. Audrey, of course, your conversation has now lit up the chat board, and I have a couple questions from some chatters. And one of the questions is, are you familiar with the power flossers? And what is your thought about the power flossers?
A power flosser.
As I was saying earlier, anything that will get the food from in between out around the gum line. Because that's one of the signs. I have worked in a periodontal office, and the first thing I ask my patients is that, do you floss? Do you brush? To me, flossing, and like I said, it's equally as important as brushing. And you need something to get it out. Get the food, get whatever's a plaque, remove all that from around the gum line.
And
what is power flossing?
That's a device. A power flosser is some are battery, electric. You know, you have a little machine and just go in between the teeth. It'll remove the plaque from the material from around the gum line.
Okay.
So you can do it mechanically, manually. There are different devices to just remove the material from around your tissues.
So just remove it. Because you know what? You can kind of tell when people don't floss because the brush stinks sometimes.
Yes, because all that food material that's left is at the gum. It's basically decaying underneath the gum line. It's gone through a chemical reaction. It's breaking down. Because remember, it's a lot of bacteria in the mouth.
Well, and let's get on that for a minute when we talk about halitosis, bad breath, and I know we joked earlier about being close to someone with bad breath and then leaving a taste in your mouth, but the reality is, stop laughing, Tim Bad. I'm sorry,
I was drinking something.
Bad breath can be caused by by poor oral hygiene, but also sometimes it's more gastrointestinal.
Yeah.
Other factors at play.
Mm-hmm. I've heard that.
Like
Yeah.
it could be a symptom of something else going on in the body. It doesn't necessarily mean that it's in your mouth.
But that's
it could be coming from your stomach, and you breathe it through your lungs, and it's coming out through your mouth. So it could be other issues that are causing you to have bad breath. And if you go and you do a deep, let's say you had a good cleaning, a deep scaling, then you still have problems, you will more than likely refer you to a GI specialist, a physician. It's a problem. We've exhausted all options, and we've done the cleanings, the antibacterial rinses, antibiotics. If it doesn't clear up, there's something else.
Got to go somewhere else.
Now wait a minute, Sharon. Dr. Audrey, you said something. You mentioned scaling. What's scaling?
Scaling is with patients and with a deep cleaning where we numb you, then we go and clean down all that food that's left, that's gone through the chemical reaction, all that deposits that's down underneath the gum line. We take it, pull all that material out
with that hook.
Woo!
The little without scalers or without ultrasonic instruments. Mm-hmm. And once we clean that area out, and we in some places we inject antibacterial rinse down into the pocket, into the gum line, and then you will have better reattachment of the tissue tooth back to the tissue, so it'll heal. As your gums heal, they'll shrink and they get tighter around the tooth. Remember that if your gums are smooth, shiny, puffy, red, that's an indication of inflammation. When they're firm, hard, and they look like an orange, which is called stippling, that's normal morphology of healthy gums. That's the way you want your gums to be: firm, knife-edge, tight around the tooth. Anytime they're flappy, loose, shiny, smooth, and puffy, that's not a healthy state.
And also, Doc, what does it mean when you have dark gums?
When your gums, that's just the melanin in your gums.
Oh, okay.
Because some patients, especially Afro-American people, are different.
Sure.
Arabs, certain people have melanin. It's just like on your skin.
Sure.
And it could be brown, it could be black, and that's normal. As long as it's healthy, there's no problem.
Right.
But if they're swollen and inflamed and they're not healthy, that's another issue. You can have dark gums and they'd be unhealthy. But as long as they're firm, knife edge, stippling around your tissues and they're healthy, it's okay.
So,
the
Doc,
melanin, the colored gums are fine.
Okay. And Doc, so when the medical experts, when they talk about the relationship between poor oral hygiene and heart disease, can you kind of talk about that a little bit?
Oh, sure. Well, we know when you have poor oral hygiene, all that bacteria in your mouth, all that can go throughout your bloodstream. And we know that can affect your heart. And we see cases with people with strokes, and they have a high incidence. People with strokes, heart disease, they have a greater incidence of periodontal disease. In fact, it can make it worse. If you have, it can make respiratory problems worse. If you're pregnant, if you have gum disease, you can have a low birth weight baby. If you're diabetic, it's a pre-existing condition. It can actually make the condition worse. Those are all factors for gum that can make gum disease worse. Okay, stress can make it worse. Smoking, all those are factors can make gum disease worse.
And you bring up a great point. Now, for our listeners who smoke, are there extra precautions or extra things that they should do in terms of their oral health care?
First, they need to stop smoking. That would help.
Okay.
But they need to make sure to get their teeth clean on a regular basis.
And how often
because
would
you
that
want to
be?
move all those irritants and stuff that's in around the gum line and on their teeth.
And
that's one of the factors.
How often should a smoker get their teeth cleaned? And also, how often should they be brushing every day?
They should brush at least twice a day.
Yeah.
Okay.
At least twice a day, and that depends how many cigarettes that they're brushing a day. They're heavy smoker. Maybe if they have access at least do an extra brushing at least 3 times a day. But they're gonna have to come in at least get the teeth clean, at least to maybe extra cleaning. Maybe because some patients come in every 3 or 4 months to get their teeth cleaned.
Mm-hmm. Mm-hmm.
And so, do you find when you're treating a smoker that when you're doing things like teeth cleaning and digging down the gum line that you find additional challenges, or is it just depend on how well the person is taking care of their teeth?
It depends on how well the person is taking care of their teeth.
You never
Some
get down
patients
to
have
that.
some patients have immaculate hygiene, and some patients don't.
Sure.
So, like for smokers and stuff, do you
Yes.
give tests for like cancer, oral cancer and stuff?
Well, yes. After all patients, each time they go to the dentist, at least if they don't do it, ideally you should do it every time you get your teeth cleaned. But every 6 months they should have a simple oral cancer exam. Now, some offices actually have these oral cancer kits that they swipe and they take a swab test or a brush test and they analyze it for any type oral cancer in the mouth. We check your tongue. We check for any nodules at the bottom of your throat. We check the splatter, the size of your tongue, the roof palate of your mouth. We also go in and check underneath your chin, your jaw, feel palpitate along the neck, the side of your neck. We check the jaw for any deviation in your jaw. All that should be part of your dental exam.
Wow.
How much does genetics play into some of the, someone being, genetically predisposed to perhaps, gums? Some people have, good teeth, but their gums, may bleed or may have problems, and vice versa. Some people's gums are strong, but their teeth. Can you have strong gums and bad teeth? I guess you could if you didn't take care of them.
Well, there is a genetic component too. We know in families, there's a family history of gum disease in certain families. We do see that, and we do see that clinically in the office. So, and plus when you get into that, there are other factors. You get into like immunology. You get into to the underlying mechanism for the destruction of the gums, and all this has to do with interleukin-1 gene, and its relationship to periodontal disease. So it does exist, and we do have families who come in here generation upon generation of gum disease, but also we try to make sure that they have a good hygiene program too, and that's the key. You have to have a good oral hygiene program. You have to go to your dentist, and you have to have your teeth cleaned and checked. Did that answer your question?
It did. Yeah, it did. Because when you talk about going, the one thing that used to make me nervous was that scaler. Ooh, that thing. The scale. That's right.
It's all in the hands of the practitioner.
Well, that's true too.
It's not as bad. They can give you topical anesthesias. We can give something to numb you. Now they have all types different anesthetic gels. You don't have to get an injection or needle. There are a lot of things now that are much better, so you won't really feel anything.
You
won't have any discomfort.
I think the scaler was part of what started the dance twerking. Because I did more dancing with my butt in the chair. When I used.
It depends on the hands of the practitioner.
That's right. Well, I got to come see you. I got to drive all the way to DC.
Sinbad, Dr. Audrey filled a tooth of mine without any anesthesia. True story.
Good gracious.
True story. I felt nothing.
Wow.
Nothing.
You make me want to go get a cavity now. Just so I can come down there.
Oh no.
No. Now that's another. Now cavities, because a lot of people who haven't been in a long time. Now, was there something to the fact that the cavities of old had like traces of mercury or something that they used to do? Should people? Was it getting the amalgams now? The amalgams, yeah. Mm-hmm.
Well, most offices do the composited two-colored filling.
No, he's talking about
And
back in the day.
some people have apps. They don't.